Welcome to this educational program. This module provides an overview of age-related macular degeneration, or AMD. Other modules are available that describe specific details of the evaluation and treatment of AMD. This information is taken from a recent review of the medical literature and attempts to be as comprehensive as possible. However, it may not necessarily reflect the experience of your surgeon or the specifics of your situation. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendation. Any mention of drugs or medical products does not necessarily imply their endorsement. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or skip through them in any order you wish. This program aims to provide you with a basic understanding of AMD, its effects, types, risk factors, diagnosis, and treatment. It also discusses what living with AMD might be like, and provides some additional resources you may find useful. AMD is an eye disease that affects people aged 50 or older. It impairs vision and gets worse over time. This vision loss can make normal, enjoyable activities difficult, significantly affecting your quality of life. The good news is that AMD can be detected early and can be managed or treated. AMD cannot cause total blindness, as it affects only your central or straight-ahead vision and leaves your peripheral or sideways vision untouched. Vision aids, doctors, and your family and friends can all help you deal with vision loss. Adapting to living with AMD and preserving your independence are possible. AMD is the leading cause of severe vision loss in the Western world. Over 2 million Canadians are living with some form of this disease. Before discussing the details of AMD, it is important to understand some anatomy of the eye. This illustration shows a side view of a normal eye. At the back of the eye is a thin, light-sensitive tissue called the retina. The retina receives light, forms that light into images, and sends those images to the brain, enabling us to see. At the center of the retina is the macula. Macular degeneration is the breaking down of the macula, the area that processes our central vision and enables us to see details and color. Sensitive, small, and tissue paper thin, the macula is particularly vulnerable to deterioration. As the macula breaks down, our sharp, central, detailed vision is impaired. AMD alters the central vision we require for activities like reading, watching TV, driving, working, telling time, or recognizing faces. Someone with AMD might require a magnifying glass or more light to read. They might need assistance with daily living, or might have difficulty driving, for example. There are two types of AMD, so-called dry AMD, or early stage, and wet AMD, or advanced stage. Dry AMD is the most common form, accounting for about 90% of patients. It is a slowly progressive thinning of the macula. When the delicate tissues of the macula become thin, they stop working well. As a result, vision is blurred. The early stage of dry AMD is characterized by drusen, small white or yellowish deposits on the retina that don't really affect vision all that much. You won't be aware that these deposits are forming, but your doctor will be able to see them. The drusen build up over time, causing you to see blind spots in your central vision. Because dry AMD is slow progressing and painless, it can often go unnoticed until a later, more severe form of the disease develops. Over time, dry AMD can actually become wet AMD, which is potentially more damaging. Regular eye checks are crucial, as your doctor will be able to see signs of dry AMD early on. Management of dry AMD involves regular monitoring of the disease. Surgery has shown to be ineffective. The wet or advanced form of AMD is less common, accounting for only about 10% of cases, but it is more damaging. Wet AMD can develop rapidly and cause severe vision loss. Wet AMD involves the development of new blood vessels at the back of the eye that can rupture and bleed. This bleeding is usually accompanied by vision loss. The blood leaves a scar which can cause you to see a dark spot in the center of your vision, called a scotoma. During an eye exam, pictures can be taken of these blood vessels that allow the doctor to see any bleeding. There are two major types of treatment for wet AMD. One treatment uses a laser to seal leaking blood vessels in the back of the eye. The other major treatment involves a drug that prevents new blood vessels from forming in the first place. Both treatments involve regular follow-up visits to your eye doctor. To summarize, dry AMD is slower, more common, and less severe. Wet AMD is faster, less common, and more severe. Although different, both types of AMD affect the macula. Therefore, both types take away from your central vision. It cannot be emphasized enough that the signs of AMD might go unnoticed for quite some time, and early detection is critical for preventing or delaying vision loss. With a comprehensive eye exam, your eye doctor can diagnose AMD early, long before any vision loss occurs. Signs of AMD could include losing the ability to see objects clearly, having difficulty with tasks that require detailed vision, noticing distorted vision, where straight lines seem wavy or bent, or possibly seeing a dark or empty area in the center of vision. Someone with AMD might see a blurry, wavy, or bent image with a blacked-out center. AMD is multifactorial, meaning that it has many possible causes. We do know that certain risk factors increase the chance of developing AMD. There are some risk factors that you cannot control. Age, for instance, is the factor that most increases your chance of developing AMD. The risk of developing AMD is a mere 8.5% for people aged 43 to 54, but up to 37% in people over 75. AMD can also run in families, affecting some or all family members. AMD is more common in women and is more common in whites. There are other factors that can be controlled. Research advises us to quit smoking, exercise regularly, eat a diet rich in fruit and vegetables and low in fat and cholesterol, and to reduce exposure to UV light. The process of diagnosing AMD begins with a careful eye exam by an optometrist, a doctor of optometry, or an ophthalmologist, which is a medical doctor who treats eye disorders. If the doctor suspects that you might have AMD, he or she will likely refer you to an ophthalmologist who specializes in these conditions. This specialist will help determine what type and stage of AMD you have by using a procedure called fluorescein angiogram, which is a type of dye test that examines blood vessels in the eye. He or she will then advise you on the best type of treatment. The following slides explore this process in more detail. The eye exam may be done routinely or at your request. First, to assess whether or not you have dry AMD, the doctor will take a detailed look inside your eye, looking for drusen, those deposits which are characteristic of this form of AMD. He or she may also show you an Amsler grid, a diagnostic test used to see if you notice any missing or wavy lines, as someone with AMD would. If your doctor suspects that you might have wet AMD, he or she will likely refer you to a retinal specialist, which is a doctor who deals specifically with the retina and macula at the back of the eye. This specialist will perform a procedure called a fluorescein angiogram to determine the type and stage of AMD you have. During the fluorescein angiogram, a dye is injected into your arm. The dye will circulate into your bloodstream, making the tiny blood vessels of the eye easier to see. The doctor will be looking for signs of bleeding, which indicates wet AMD. The retina specialist will advise you and offer treatment if appropriate. You will likely return to your regular eye doctor for further regular checkups. If your doctor diagnoses dry AMD, you will discuss disease management. If, on the other hand, you have wet AMD, The doctor will discuss treatment options with you, explaining the benefits, risks, and effectiveness of the treatment. Vision loss can really take a toll. It can alter your ability to perform certain activities and can be emotionally devastating. You may experience shock, anger, sadness, loss or depression, and living with AMD may necessitate lifestyle changes that could be difficult. Please understand that your eye doctors and your network of family and friends can help you adjust to living with AMD. Because so many people are affected by AMD, and because of its potential societal impact as our population ages, researchers are actively looking for methods of AMD prevention and treatment. There are numerous resources to educate you and help you cope with AMD. These are just some of them. For more information on ongoing research and clinical trials, please visit www.blindness.org. There are also support groups, such as AMD Alliance International, that can help you as well. Perhaps your doctor will know of a specific support group in your area. Vision rehabilitation is available in eye centers across Canada and through the CNIB, the Canadian National Institute for the Blind. These websites also provide information on AMD. We hope that this program has furthered your understanding of age-related macular degeneration. We wish you the best for the future, and thank you once again for viewing this educational program. Or situation. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendation. Any mention of drugs or medical products does not necessarily imply their endorsement. Please feel free to view this presentation as many times as necessary. Other modules are available that describe specific details of the evaluation and treatment of AMD. This information is taken from a recent review of the medical literature and attempts to be as comprehensive as possible. However, it may not necessarily reflect the experience of your surgeon or the specifics of what living with AMD might be like, and provide some additional resources you may find useful. AMD is an eye disease that affects people aged 50 or older. It impairs vision and gets worse over time. This vision loss can make normal, enjoyable activity. You may also use the player on your left to repeat slides or skip through them in any order you wish. This program aims to provide you with a basic understanding of AMD, its effects, types, risk factors, diagnosis, and treatment. It also discusses Welcome to this educational program. This module provides an overview of age-related macular degeneration, or AMD.